Hey, sorry, I had a bad connection. I'm back at my house now, so I was transferring over to my home Wi-Fi network. Um, yeah, so some people were asking about autoimmune diseases. Obviously, it's also going to depend on your severity of your autoimmune disease, medications you're taking, and any other comorbidities you're having. And that also has to factor into your risk-benefit profile for taking a vaccine. Just like with any other decision in life or any other medical decision, you need to look at what is the best option for you. So, for those that are tuning in now, this is some interesting information about the long-term effects of COVID. The picture got cut off. I tried to crop it so you can see it better, but the information from Pfizer and Moderna has started to come out, and they've been studying it now since last July. Millions of people have had it, and we haven't really seen any significant long-term effects thus far, which is over a year, which is pretty good follow-up so far. No non-live vaccine has been known to cause significant effects years later, and the COVID vaccine is a non-live vaccine. And then our COVID-19 vaccines leave the body within 72 hours, which means that a lot of the information that's in or substances within the vaccine are metabolized in the body within that time frame. The only thing left behind are the antibodies that fight off the infection and some of the memory within your immune system. And then serious side effects following vaccination are extremely rare. Yeah, some of the other things that we just keep seeing more information regarding pediatric populations, and that's what the worrisome thing is right now. To mask or not to mask, those going back to school, and the fact that a large percentage of school-age children, those that are 12 and under especially, aren't eligible for the vaccine. So you have to factor in that when you're worried about the spread of COVID amongst school-age children. And then it's not just them, it's also the fact that hopefully they're more resistant than adults, just like the first time around, even though the Delta variant does seem to be a little bit more contagious among children. You just hope they don't take it home to family members, high-risk individuals, particularly like anybody with chronic conditions or their elderly grandparents or even their parents. So, and then God forbid the children become critically ill. So, let's see. mRNA. Yeah, so the vaccine is mRNA. The vaccine ruins your immune system. So is this the antibody enhancement theory that we're talking about? 1, 2, 3, 4, John Doe. So that there was some evidence of that in animal models, but none of that has been shown to be the case in human trials or in patient follow-up for people that have been exposed to it. I had COVID and was hospitalized. I had plasma with the monoclonal antibodies they gave me. Well, I hope that worked for you. From all the literature I had read, there was pretty good information trying to look at the use of transfusions and those that have had antibodies. There wasn't anything too promising, but hopefully it worked for you. It sounds like you did, and I'm glad it did work for you. So let's see here. Ribosomes are compromised. I mean, that's where the mRNA goes. I don't know what you mean by compromised. If you had a situation where the mRNA was going in and damaging ribosomes on numerous immunologic cells or cells throughout the body, then your whole protein synthesis for your body would be significantly thrown off. And that's just not the case. I mean, we have millions of people that have gotten the vaccine and go about their daily lives again. You might have some mild reaction initially, like people have with the first or second shot. Some of them have a mild reaction. Some people do have a significant reaction. They might be, pretty fatigued, significant muscle aches, and a fever for a few days, but even that's pretty rare, and the chances of blood clots that people have talked about before are exceedingly rare. Lower than things like being a smoker or birth control or recent surgery. All of those are higher risk factors for having a blood clot than the vaccine itself. If vaccines are so safe and effective, then why no liability? So, I mean, the vaccine literature is saying that it's safe. We've seen people that have taken it that show it's safe. The liability, I can't speak to. That's a legal thing. That's likely protection for the manufacturers. And they probably also didn't want to go about making a vaccine in the event there was a some type of problem, they didn't want to be held liable, and I don't think that that is necessarily the correct thing to do. They should stand behind their product, but I also think that it may have curbed innovation. People might not have been as willing to do it if their company could have been held liable. But all I'm going to say is that what we have seen thus far is that people have had success with the vaccine, as well as it's been safe. It's now FDA approved, which I know a lot of people that don't believe a lot in the pandemic, believe that the FDA has its own issues, and that's a different topic. But for the most part, the FDA does try and do the best it can of preventing things to make it to market that are causing more people problems. But that doesn't mean in the history of the FDA they haven't made errors. Let's see here. So how many booster shots? Every 8 months for life? So no, and I talked about this yesterday. This is my personal opinion on this, but when you have the flu, for example, we have an annual flu shot because the antigen on the surface changes every year, and we need to try and predict that. There's some cross immunity from the prior year, about 20 to 30% for either the flu shot or natural immunity if you had the flu. But you don't always know how strong that is the following year. So you do need a new shot each year because of how quickly and significantly the surface proteins have changed. Now with COVID, fortunately, we've had cases and everything since 18 months ago now, and we've seen a change. There is a Delta variant now, but the problem is, but the good news is we haven't seen such a change where the previous vaccination to the Alpha variant is no longer effective. It's still very effective, and that's a good sign for us that if people can get on board with being vaccinated and continuing to mask, that we might be able to get to a situation where we knock down the amount of eligible hosts so much that the virus doesn't have a chance to spread quickly. And also, it's a numbers game. So if we can decrease the probability of a mutation by decreasing the amount of replications that the virus gets to go through, you prevent the opportunity for a new mutation. Let's see here. No long-term effects found. So what that means is, based on all the information we have about other non-living vaccines, which we have a good amount of non-living vaccines in the medical community, from the time that they may have been introduced to years following that, there's never been a time where the vaccine has popped up 5 years later to be causing some significant side effect. The COVID-19 vaccine is out of your body within about 3 days, and it's mostly metabolized very quickly. The only thing that's left behind is the memory for your immune system if it runs into COVID-19, or the antibodies that stay around. And millions of people have had it and haven't had an issue in a year. So I don't know. I mean, long term, if you're talking 10 years from now, what are your options? Are you going to wait 10 years for follow-up before you're going to address something that's killing millions of people now? And I mean, and from everything we've seen in these trials, so these are phase 3 trials. They're large trials that had occurred back in July of 2020. So those phase 3 is when you start to look at how well they work, and you have continued follow-up for adverse effects. And we haven't seen anything since then, or we haven't seen anything major so far. How do they explain all the deaths and serious side effects? So anytime you're going to have medical related stuff, even food allergies, you're going to have certain people that are going to have a reaction to it. But if you compare the overwhelming majority of times where people get an effective vaccine without having a problem, compared to and then those same individuals not being able to spread the disease, compared to the time where somebody's died from the vaccine, it's not even close. I mean, you're having people that are preventing themselves from being sick, their peers, their loved ones, by getting vaccinated, and their chances for a serious side effect or death are extremely low. I mean, you get a risk-benefit everything. You get into your car or some type of form of public transportation, maybe not now if you're on any lockdown or anything like that, but in your normal life, you take a risk of being in a fatal accident, but you still go ahead and do it, and your threat of dying from COVID is more than your threat from the vaccine. Let's see here. Yeah, so you're putting others at risk. That's the main thing by not getting vaccinated. And I know people will say, well, it's not their responsibility to do that, but it's the idea of preventing the chance for a mutation to occur. Anytime we're allowing people to um, people to not be vaccinated and them to have the opportunity for the virus to replicate within them, you're talking billions and billions and billions of replications. And all it is a numbers game. The virus isn't thinking about it evolving or mutating. It's just the thing that happens by chance. A piece of its sequence changes to the point where it becomes more and more and more contagious. And when that happens, that new strain becomes more common just because of the law of probability. That one strain will now infect more people than the previous strain, and unfortunately, if it becomes more contagious and more harmful, we now have a transition from a previous strain to a new strain. And thank goodness, so far, the new strain is still covered pretty well by the previous vaccinations. If we continue to have new mutations that occur, and we get to a situation where the previous vaccine is no longer effective, we're back to square one despite all of our efforts. And that's why we need better buy-in about vaccinations. And I'm not here trying to, shame anybody for not getting vaccinated. That's not why I'm on here. My goal is to spread information to those that are on the fence about being vaccinated, because the people that don't want to get vaccinated aren't going to be vaccinated, and that's their decision. But all we can try and do is reach as many people as possible that are on the fence, maybe have questions, and that's why I'm trying to be here to help. It's going to mutate regardless. So I'm not arguing that it's not going to mutate. So that's the idea. It's a numbers game, just like with anything in medicine, just like with any virus. The more opportunities you give something, the more opportunities you give it to mutate, it's going to mutate by chance alone. So by giving people vaccinated and decreasing people's viral loads as well as their chance to spread it to somebody else, you're significantly reducing the chance that some new mutation will occur that will make it more contagious, or God forbid, the current vaccine is no longer effective towards it. Why can you still get COVID if you're already vaccinated? So the thing about that is no vaccine has ever been designed to prevent you from getting infected. The idea is that, say the viral particle is near you, it still has the same chance of entering your nose or respiratory tract, whether you're vaccinated or not. But once it starts to get into your system and starts to replicate, your immune system starts to recognize it very, very, very quickly if you're vaccinated. And then it can mount an immune response. There's not a learning phase. If you're not vaccinated, it has to go out, identify the viral particle, make antibodies, go out and fight it. You're going to feel a lot worse. And also there's a lag time. So while your body is trying to recognize it as an unvaccinated individual, the virus is replicating. So your body has to play catch up. And for those that are susceptible to it or high risk, that's the time that they end up in the ICU with high viral loads, respiratory compromise, their heart get damaged, their organs get damaged, and that's what your biggest concern is. When you're vaccinated, obviously you still have the 5% of people that might be non-responders to the vaccine. So the vaccine isn't perfect. Nobody's ever said that, but there's a 95% chance that it will be effective for people. And when it is effective, your body will immediately recognize the virus protein and start ramping up production of the antibodies. And also you have some existing antibodies already in circulation that will start to fight it immediately. So that's the main thing. I've been traveling since the start, no mask, and according to the doctors and CDC, I should be dead. Well, that Blaze 7788. So that's not true. I mean, we've already known that the fatality rate isn't terribly high for a healthy individual. That's not the issue. The issue is the spread to other people and the fact that we can potentially make a virus that's mutated and can cause more and more problems and be more deadly. That's the concern. You might be somebody who you may have already had it and been an asymptomatic individual and recovered, and that's fine. And I'm not here to shame you and about not wearing the mask or anything like that. But I'm just saying that it's all about the probability and the law of large numbers, that when you're exposing what was a novel virus to the whole world without any native immunity or any vaccinations, you're going to have a lot of death, because even if you have a smaller percentage of people that will be hospitalized or die from it, that's a 0.1% or 0.01%, whatever people want to quote as the death rate of however many people. I think we have 8.5 billion people on the planet now. That's a lot of death, even if it's a very small percentage of death, or a very small percentage chance of death. You need a mod to squash the trolls. So, I mean, I was thinking about adding that, but the thing is, I don't mind people saying what they want to say on here, and sometimes they can air out what they need to talk about, and sometimes I'm able to answer questions for them, but occasionally you're just going to have problems where people aren't going to change their mind, and that's what they're entitled to do. And they're just not going to change their mind, which is fine, but at least it allows me to speak on things where people have preconceived notions and maybe address them for them. The vaccine is creating the Delta. The homing pigeon 52, that's just not true. The vaccine wouldn't cause a new virus to occur. The reason that the variant occurred was, like I said, people being infected and having mutations occurred that made a more contagious virus. It's all about chance. I've said it before. The virus doesn't have a brain. It's not thinking that it's trying to evolve. It's purely chance. When you have replication, you have chance that a new code will be written just by the fact that you have billions and billions of replication cycles of the virus, and there's going to be mutations in there. And a large percentage of the mutations will either lead to no change in the protein, or it could lead to a virus that's no longer functioning. But occasionally you're going to have times where that low chance of a mutation becomes more contagious and more dangerous. Yes, you can still get it, but your chances of having a severe case is lessened. And that's the whole point. I don't, and I actually apologize to people who either this was conveyed to them that way, or they felt that that's the way that this was being portrayed to individuals. But no vaccine has ever been made that will prevent you from getting something. I mean, even with a robust vaccination and immune response, your body still has a little lag time to start fighting it, but it kicks in so much faster than having to develop a natural immunity to it. How much are you getting paid? It's our body. Like, also when you force abort. I don't know where that came from. I've never been involved with abortions at all, so I don't know where that came from. And I'm not getting paid anything. I said this before. The only thing I get paid on here is a content creator. I don't get paid for the live sessions. These are just to educate people. The only thing I get paid for are my silly videos that I make to make people laugh, just like any other content creator. I don't make anything extra from TikTok or anybody else. So I don't know where people keep saying that, why people keep saying that. So let's see here. Am I going to apologize to those that get cardiomyopathy? I've said numerous times that individuals that may have received a problem from the vaccination, that it's sad, and nobody is going to say that you're not sad when that happens, but it's a risk-benefit scenario. There are far more people who have heart, lung, and brain injuries from COVID itself than the vaccine. Again, risk-benefit. So the person that unfortunately had an issue with the vaccine may have also had an issue had they contracted COVID, but they're also the exception, not the rule. The chances of a problem from the vaccine are very, very low. Why have they pushed this vaccine more than others? I mean, the reason they pushed this vaccine more than others is because we haven't had a pandemic like this in decades. I mean, we haven't quite gotten to the proportions of the Spanish flu in 1918 because of better healthcare systems and access to healthcare. But this is the only time we've seen millions of people across the world dying, and hundreds of thousands, if not a million, people dying in the United States. So that's why you're seeing the vaccine being pushed forward. And at this time, we're not seeing mandates. People aren't they're not having people show up to your home to vaccinate you. There are times where businesses or private establishments might like for you to be vaccinated, and that's their choice. Everybody talks about freedom in our country, and that's one of their rights too. They're allowed to do what they want with their private residence, or if it's a privately owned business and they want their employees to protect themselves as well as, in our case, patients or other customers and other areas of business, then that's what they're going to do as well. So it's still up to your choice. Do you know when kids under 12 can get the vaccine? Unfortunately, I don't. The last thing I had heard was that there's ongoing research that likely they'll have it by mid-winter. Unless that time frame gets pushed up from very promising results and very little side effects seen, they're not going to be pushing as quickly. There's a less margin for error for children. Also there you can protect children by keeping them home. Now with the economy opening back up, people having to go back to work, but the adults can't stay home as frequently. Remote work's an option, but that's the main thing. I don't think it'll be forced out to kids. They're going to want to really research that. So does the Pfizer shot wear off? And this is why we need a booster. So the last time I had looked at this, and I have to look again, but I thought 8 to 9 months or so of solid immunity I have Pfizer, and that's what I saw. And I think Moderna was in the same boat. So you have to remember that immunity could wane, but you're definitely going to be much better protected and for longer than having than getting natural immunity from getting COVID, and you also forego the potential side effects and severity of getting COVID itself. Vaccine of allergy and autoimmune condition. So again, it's risk-benefit for you, and it depends on what you mean by allergy. If you have to go over the substances of the vaccine, and if they overlap with any other, if you've had an allergic reaction to other vaccines, and there's a significant overlap in the substances within the vaccine, yes. Autoimmune condition, it depends on what your autoimmune condition is, medications you're taking, and the severity. If you have a very severe autoimmune disease and you're on higher doses of immunosuppressants, you might benefit from not only your normal shots of COVID, but also possibly a booster shot to make sure that your immune system has had enough time and enough exposure from that mRNA giving the instructions to make antibodies. But again, it's an individual choice. Just like what everybody says, everybody's allowed to. So post credentials behind you. So I went to medical school in Florida, and then I did my residency in anesthesiology and critical care medicine at Johns Hopkins Hospital in Baltimore, Maryland. So I have extensive experience taking care of high-risk individuals, high acuity patients, both in chronic illnesses coming for surgery as well as post-surgical patients, transplant patients in the ICUs there. And I've been in private practice in anesthesia now for 3 years. Why do people who have COVID still need the vaccine? So this is what I was talking about the other day. So it's mainly the fact that for natural immunity, you start to see some evidence that your antibodies are lessening at about the 3-month mark. You might still have some immunity, and that's fine, but you could be at risk for reinfection, say 6 months down the road. With the vaccine, however, you will have lasting immunity for what seems to be at least 8 to 9 months so far, and there's still ongoing studies, and we'll probably have more information about the need for a booster shot in the next several months as we get more information from said studies that have been looking at follow-up on these patients. Pfizer CEO. So if you go back and look at that tweet, that's not true. The Pfizer tweet, the Pfizer CEO, the tweet came up that he hadn't received it because he wanted to wait his turn in line based on his age bracket and comorbidities and risk category. And then when the tweet came out, or somebody exposed that tweet, he'd already received his first vaccine, and then he also went on to get his next vaccine. So the Pfizer CEO, I think it was March or April, he was already getting his vaccine and he finished it. So that's not completely true. Let's see here. I'm just getting a lot of comments. It's hard to, let's see here. If I get this vaccine, thank God y'all weren't around when Spanish flu hit. Oh, don't get the vaccine, it will hurt you. And again, I'm not here to try and convince you or shame people into getting the vaccine. If you truly don't want to get it, And that's fine. I'm just trying to explain to you the idea of herd immunity and all the evidence that continues to come out about the safety profile of it, even up to a year out so far, or even more than a year. What about Crohn's? Son diagnosed back in April. So again, that falls into the autoimmune category. If they're taking high doses of medications that help with their Crohn's and also alter their immune system, that's a risk benefit that you need to discuss with your primary care physician or your Crohn's specialist about trying to make sure that you have all the information possible to make an informed decision about getting vaccinated, because you don't want to have a situation where you have an unvaccinated individual who's high risk. So this is a conversation you should definitely have with your doctor who knows your case in and out for your son. And I hope everything stays safe for you as well as your son. Once you have had COVID, doesn't make it less dangerous the second time around, and so on. So I guess your idea is natural immunity, and while that's sort of accurate, like I was saying, your immunity does wane over time. So if you got it, you have antibodies for about 3 months or so, and then it starts to wane. So you could theoretically get it again a few months after that 3-month window. And to say that it's not as dangerous the next time, it's probably not true. I mean, if you didn't have a rough time with it the first time through, then maybe you're not going to have a rough time with it the second time through, but there's no way of knowing that. And particularly if you're a high-risk individual who was hospitalized for COVID, then you definitely should get vaccinated, because if you catch it again, there's a high chance you're going to be hospitalized again, and then now we have a new variant that's more contagious, and it looks like it's affecting children more, so there is a chance that the next time you get it, it might not be that might not be the case. It might not be something you just get over. Hey doc, stop lying for the Democrats. Well, I'm not going to get into political parties, but I'm not on here for any of that. I'm just on here to help people have the information that's become available. You can do with it what you like. Why haven't I got COVID? A couple of options there. Either you've not been around somebody, which is probably unlikely. You may have gotten and just not known it, and that's possible too. And the thing is, a lot of people that might be the case for, but you also don't know. And now we're seeing more cases of those that are healthy that are starting to have more issues with the new variant. So why do the magnets stick? I don't know if you're joking or not, but that was a myth that was debunked. You can even see multiple people talking about this on TikTok. Whoever put the thing on their arm had some sweat or some type of cohesiveness on their shoulder, and then once they put baby powder on it, it slid right off. There's no magnet in there at all, and I will tell you that for sure because I work in the MRI area as well, where we give anesthesia to patients who require anesthesia for MRIs, and we're around high-powered magnets, and if I had a magnet in my arm, it would be ripped out of my arm and go to the MRI. So I don't think that is a really feasible thing. They put microchips in it. Same thing. Microchips would be magnetic. False. I've seen it personally. Well, I can tell you that I was just in the MRI scanner this past Friday helping out individuals who required our services to have their scans done, and I survived just fine. My arm didn't even hurt. So, why did let's see. Oh, sorry. Can you move so I can read it? So I can read some of it here for you. So the COVID vaccine long-term side effects. This is basically what this is. And this is from, if you want to look it up, this is common information, but this came from Chicago. So this is on like one of the Chicago public health things. So Pfizer and Moderna phase 3 trials that started back in July of 2020. So millions have had their vaccine. There's been no long-term effects, significant long-term effects noted to date. No non-live vaccine has been shown to cause the long-term effects years later. So something doesn't pop up all of a sudden out of nowhere. And the COVID-19 vaccine is a non-living vaccine. There's not even a piece of the virus in it. It's just the genetic code that goes and then tells your body what to make for the protein, the spike protein. The COVID-19 vaccine is only leaves your body within 72 hours, meaning that all the substances that are in the vaccine are metabolized and are out of your body within a couple of days. The only thing that's left over are the antibodies that your body makes in response to the vaccine to protect you, and your body's immunity will continue to have a memory of that as well. And then the last thing is down here, serious side effects following vaccination are extremely rare. And then that last piece says, in contrast, you might experience long-term health effects from COVID-19. And again, this is all risk-benefit. So your chances of having a complication from COVID itself are going to be much higher than your chances from the vaccine. Now, if you're a healthy individual, there is still a very high chance that you would either be asymptomatic or have a mild case. It might feel like a regular cold to you, but outside of that, you can spread it to somebody else, loved ones, or just anybody else. And the biggest problem here, and I said it earlier, so I'm not sure who may have been on here earlier or filtered out, is that the more times the virus replicates, the higher chances you're going to have of there being a mutation that's a significant mutation. Right now, the Delta variant's pretty well protected, or we're pretty well protected against the Delta variant with the current vaccines. But if we continue to have more and more and more mutations, then you run the risk of having a new strain that comes out that is not susceptible, or we don't have immunity to it from the vaccine. So now we're kind of back to square one. Thank goodness my daughter-in-law, who has MS, was fully vaccinated, tested positive, mild symptoms. Yeah, that's great. So that's the perfect example. Somebody who is high risk, and the vaccine seemed to work very well for them, and that's great. I'm glad that your daughter-in-law is hopefully completely recovered now. Thoughts on mandates and people losing their jobs for wanting to make their own health decision. So, to me, mandates are, you have to go to some rec center and people are forcing you to get the vaccine, or you have you can't go out in public without it. Now, private businesses that are out in public can do what they want. It is their business. Businesses that are owned in terms of where you might work, not just places you would go like a restaurant, can also do what they want. They want to protect themselves, their other employees. They're, in our case, patients, but in other businesses, they're customers. So it's still a personal decision for that corporation. Now, I think that what you're talking about is autonomy, and that is your personal choice. And I think you're completely right that you're allowed to make your own choice when it comes to your own body. But the other option, to the other side of that, is your employer has the option to enforce what they want, and you always have the option to leave your job if you don't want to get the vaccine. So that's kind of how that works for most businesses. If they're willing to say, hey, you need your vaccine, then it's up to you. You still have a choice. I know it's not an easy choice, but if you don't want to have the vaccine, then you go and get a different job. Do you think low-risk people getting it help the vaxxed high risk? Help the vaxxed high risk. I'm not sure what you mean. I don't know if you mean, do I think that if low-risk people get it, that those that were high risk that are vaccinated are protected? I think that that's the case. If a low-risk individual gets it, and even if their viral loads aren't very high and they're not terribly symptomatic, their chances of spreading it are lower. But when you're talking about protection for those that are high risk, then yes, it's better that the person that they're being in contact with is vaccinated. How is it herd immunity if you can still catch it and transmit it? How do you test for Delta? So we don't have herd immunity yet. Herd immunity is about 70% or larger of a given population to try and reduce the spread within that population. And you still can catch it. I mean, herd immunity is an arbitrary 70% that has worked for other vaccines and seems to be a good number, but that doesn't mean that it's going to be completely eliminated. The idea is that if there is an outbreak or a place where in this situation, if we had herd immunity for COVID, that it would the virus would just sort of die off because there wouldn't be enough hosts in the surrounding area. Essentially, the individuals who are exposed to it that had either been vaccinated or those that are unvaccinated fought off the virus and killed it before being able to transmit it to a new host. When you don't have anybody vaccinated, everybody's a potential host. So therefore, it can get to other people. So that's kind of how it works. And how do you test for Delta? most of your tests so for example, when we test patients for surgery, it just tells us if they have COVID at all. So there are more specific tests that you can send off to other labs to determine what variant it is, but we don't really need to know the specific variant for surgery or not. We just need to know if they have COVID or not. So you can do that, but you don't have to differentiate that for different clinical settings. Dan RB86, are you a real doctor? Yes. I got my medical degree in 2014, and then I graduated from Johns Hopkins Hospital's anesthesia and critical care medicine residency in 2018, and now I've been in private practice for over 3 years now. So I'm a real physician. You can look it up. You can go to the Johns Hopkins ACCM website and see me on there as being a graduate from 2018. How do you see this emergency use as non-malfeasance with a lack of diversity in trials? So the whole idea with the vaccines is what you're saying is you don't want to harm anybody now malfeasance. But the idea is that you're always looking at the risk and benefits. If you have something going on where hundreds of thousands of people in the United States and now over 1 million are dying and millions around the world, regardless of ethnicity, then you need to extend that vaccination to everybody. I mean, you could theoretically wait until there's more diversity in the trials, but that also comes down to people signing up for the trials. You can't force people to enter trials. You try your best to make a diverse inclusion so that you're right, you have information for subset populations. But everybody's being affected. And if in the beginning, the African American community, there was evidence that they were being affected higher because of higher amounts of certain enzymes within their body, the angiotensin 2 receptor and ACE enzymes in the body that may have made it easier for COVID to enter their cells, and they might have been more prone to serious effects. More prone to higher severity of infection. So you need to make sure that you're giving the vaccines to all populations, and unfortunately, if there's not enough data for a given subset within the study, you still need to extend it to them so that everybody has the opportunity, particularly if their risk is high. Pfizer CEO is not vaccinated. He don't trust it. Well, that's wrong. I just talked about this a second ago. The Pfizer CEO posted his tweet that he was not going to get it initially because he was waiting his turn based on his comorbidities and age bracket. And then within a couple of weeks of that tweet, and it was sometime in March, he got his first dose. And then a few weeks later, he got his second dose. And you can look that up. Somebody who posted that tweet that you're referring to also retracted that tweet when they realized that they looked into it further. So you can go ahead and look that up if you'd like. Let's see here. I survived. KGal76. I hope you mean COVID. I'm glad that you have that you survived that. And that doesn't mean there's no reason for other people to be vaccinated. So let's see here. Let's see. How long do you think some? Isn't the Delta variant? Isn't the Delta a vaccine-resistant strain? I think you're saying, isn't the Delta strain resistant to the vaccine? And the answer is no. Do I believe in forced or coerced vaccination? No, and that's what I keep saying on here. I have a lot of people that are anti-vaccine on here trying to say, bad things about the vaccines, and they're allowed to do that, but it doesn't really help anybody. There's plenty of information coming out about the safety profile of the vaccines, and people continue to say the same rhetoric over and over again about problems with the vaccine. Pregnancy and vaccine. So unless ACOG, the American College of OB and Gynecology, has changed their guidelines, for a long time it was those that were high-risk pregnant patients, meaning high-risk comorbidities, likely patients with preeclampsia, gestational hypertension, diabetes, things like that, or those that were healthcare workers that were going to be high risk of exposure. Those were the ones that were recommended to have vaccination. So those individuals, and they've continued to study them. There's a whole registry on this, and they haven't seen any increased rate compared to normal for high-risk populations of loss of pregnancy, and then the whole thing of infertility has completely been debunked at this point. So, but again, if your individual case, you always need to talk to your physician and your OB if you're talking about pregnancy, and weigh your risk benefits for your given situation. Let's see here. Keep pushing the death jab. You will be putting a target on my back. I mean, you can say what you want. I'm not pushing the death jab on anybody. All I'm saying is that this is the information we have, and with any amount of high quality information, the public should be informed of it. Just like people are allowed to come on here and say actually invalid information on this feed about certain other treatments or problems with the vaccine, people should be able to hear about what's going on with the trials and information for the general public. Do I think this was planned? Like the whole pandemic? I don't think so. I mean, I don't know what the intentions were of whatever lab this was concocted in. I don't know if it was trying to be a biological weapon that maybe have gotten out. But I can't comment on that. That would be something that would be a really big conspiracy theory for another country to do some type of biological attack. But I don't think it was planned. All I know is that it got out and we had to deal with it. Let's see here. So 2 people I know last week died and both were fully vaccinated. Sharp dress print. Well, I'm sorry to hear about your friends dying. And the thing is about the vaccinations, and I've said this time and time again, unfortunately they're not 100%. So 95% of individuals take the vaccine, the Moderna and Pfizer at least, will have good response. And now with the Delta variant, it's likely closer to 90%. So out of 100 people, even if it's 90% now, 10 could still be susceptible to getting and catching the variant. And of those, you could have people that are going to require hospitalization and going to the ICU and being on ventilators. And I'm genuinely sorry to hear about your 2 people that you knew passed away. And the thing is, you don't know whether they were just truly susceptible despite good immune response to the vaccine, or maybe they were part of the group that didn't have a good enough response to the vaccine to allow them to have adequate immunity. But regardless, still somebody dying is not what we want to see in this pandemic. There's been way too many lives lost, whether you believe this was a plandemic, whether you believe in the pandemic, or whether you believe in vaccination or not. There's just been too many deaths that have occurred because of this. Let's see here. Let's believe a brainwashed doctor. So, these are another set of comments, which is completely fine. You're allowed to say what you want. Everybody's entitled to their opinion. But I see it in our own hospital. Luckily, we are in a smaller area, so we haven't seen it nearly as bad as other places, but we're already seeing another uptick for our 4th wave. Other places throughout the country, when I trained at Hopkins, we had a very large anesthesia and critical care medicine class, so I have friends that are ICU physicians now throughout the country, New York City, but also down in Florida. In Florida, in certain areas, particularly the Jacksonville area, they're starting to have issues again too. What about fertility and Pfizer? All the information that we know thus far, there was initially thought to be an antibody response to a placental protein. That's where that initial theory came from. But all of the follow-up information we've seen thus far has not shown any increased issues with that. Do they have a specific test for the Delta variant? So where I'm at, we just test for COVID related to people coming to surgery, but there is a way to differentiate it, and it's likely, unless you're at a very large institution, it's likely a send-out test. Let's see here. What vaccine is the safest? I'd have to go and look at all 3 trials to look at the chances of reactions, but I do know at least that Pfizer and Moderna seem to be about the same in terms of excuse me, in terms of reaction. So those are their chances are very low of getting an adverse effect. Let's see here, ivermectin. So I had this the other day. Somebody mentioned Dr. Corey in his testimony, and I looked into the ivermectin thing further. And I even said this the other day, that ivermectin was probably one of the only things that had any data that was positive. Everything else was completely debunked in numerous studies. Now, ivermectin did have some positive results for certain trials. Now, they did what's called a meta-analysis, which means they take a collection um, of trials to collate all the information to get a more profound effect. And it did have some information in that it could be effective. The only problem is when you have a collection of data and the individual studies are small or relatively lower quality, just because you put them all together doesn't mean that all of a sudden you have one gigantic great trial. So while the information is helpful to know, and ivermectin could potentially have some type of implications here in the future, right now we just don't have enough information that it would be safe based on the studies we have so far. Now there are ongoing trials, but the problem is you don't know dosing for these things, and you can't just unleash a medication that has never been researched with COVID up until recently across a population. It's the same thing as people talking about the vaccine. You know, the vaccine has honestly been researched longer now than ivermectin has when it comes to COVID. Ivermectin has been around longer than the vaccine, but there's no indication, there's no FDA approval that's been studies that have been looking at ivermectin. Ivermectin does possibly have a role, but at this time we don't know the side effect profile and how well it will work. My sister got really bad blood clots. She's a healthy 34-year-old. Terrible. I'm sorry to hear that. Whether that's from the vaccine or getting COVID itself, I'm sorry. I don't know which caused that for her, but either way, I hope she's doing okay now. Will the FDA approve? I think it said Moderna. Probably. I haven't read on that timeline at all. I know that Pfizer was the one that they were looking at. Let's see. So the studies on ivermectin, I see somebody said there are plenty of studies. So there are studies, but like I just said, with the whole meta-analysis, they use smaller studies. And the problem with smaller studies is that even if they have a positive outcome, the problem is when you have, say, 20 to 30 patients, some of them had more patients, but also their designs are not the best. And some of them aren't randomized, controlled, double-blinded studies, which are some of the best studies to have. But the problem is when you have a small patient population and you find a positive effect, you just as easily can have the opposite effect in the next trial, which is why you need a larger population to get a better representation of how that treatment is going to work in that said patient population. And I'm not here arguing against ivermectin because there is some evidence that it could be helpful. I'm just trying to tell you that you can't just unleash that onto widespread treatment without having more information about ivermectin in the COVID population. Is heart inflammation a big deal? So it depends. I mean, if the heart muscle gets strained enough and the electrical conduction gets messed up and you have heart failure where the pumping function gets messed up enough, then yes, it can be serious. Some people who have a really healthy heart and are younger, they might have some mild chest discomfort. They might get an EKG that shows signs of pericarditis or anything like that, or an echo might show some slightly affected pumping function. But for patients who are healthy, they might not notice it. Now, you could have the other end of the spectrum where people have heart inflammation and they could go into acute heart failure, and that does happen. And one of two situations happens if they don't pass away, and hopefully they don't. They either can recover or they have long-term sequelae from that and all the effects of having heart failure for, I guess, essentially the rest of their life, and hopefully medications might be able to help them. Let's see here. They won't approve ivermectin because can already be tracked with your phone. What about people with autoimmune disorders? So this is what I was talking about before. It's risk benefit for you, and you also need to talk to your doctor. So it depends on which autoimmune disease you have, which immunosuppressants you might be on to help manage your autoimmune disorder, and how severe your autoimmune disorder is, as well as any other comorbidities you might have. If you're extremely high risk, then you need to talk to your doctor about the benefits for you. And for the most part, people probably will benefit from the vaccine if you're a high-risk individual. And now this is about the 20th time I've seen the CEO isn't vaccinated. That's completely false. You can actually go back and see the person who retracted. You can see the person who retracted their tweet because they did not know the timeline on the tweets. And the individual you're talking about said he was going to wait until it was his turn to get vaccinated based on his comorbidities and age bracket. And he received his vaccination, I believe it was completed in March or April of last year. So pretty much in line with what everybody else in his age bracket did. 1 year study is not long-term effects. So it really is long-term effects. Most of your acute responses are things that are going to happen immediately within days or weeks, and then long-term are going to be months to years. And now there could be something that can happen years later, but as you can see here, no non-live vaccine has been shown to cause side effects years later. COVID-19 is a non-live vaccine. So what that means is other vaccines that we already have in circulation that are non-living have never been shown to 5 years later all of a sudden cause some major problem. Is one vaccine enough? Outside of Johnson & Johnson, no. So they tried to do that in the UK where they thought the idea was get everybody the first shot, it would get some low level of immunity. The only problem is now they're having problems with the Delta variant because it seemed that the first shot didn't give them enough of an immune response to protect them against now the variant. Those that have had two responses, those that have had two shots had a much greater response from antibodies and are less susceptible to the Delta variant. That's why you don't want to do one shot only. Let's see here. Speak on this melatonin type 1 interferon. I'd have to go back and read on those specific studies. I haven't seen those. Let's see here. Are you answering medical questions? If I can see if you have another one. Yeah, I'm trying to answer questions on here. Are they working on a safer vaccine? I mean, at this time, they're still just working on the current vaccine and following up the data on that. If there's any change with the efficacy of the current vaccine, I'm sure they will change to looking for a more effective vaccine. And anytime you tried to work on a new medication or vaccine, you're always going to try and make things safer. All right, I'm just scared and I don't want to do it. I wish there was an easy answer. Thanks for all you do. Thank you, Kippis10. Yeah, I'm always happy to help, trying to give out information, answer people's questions. If you're scared, I would talk to a healthcare provider in your area to go over your risk benefit for you. If you're high risk, I think that in my personal and professional opinion, you would benefit from it. But if you're somebody who's completely scared of it, your risks are low, high immunization rates in your area, and you're working remotely from home, you might be okay, but you're still gonna have to go out in the public at some point. So whether it's to go grocery shopping or anything else at some point. So it's really a individualized basis. I'm not here trying to, like I've said numerous times, shame or convince people to get the vaccine. It's really up to that individual. But I do think that most people, even if they're healthy, will be fine getting the vaccine because the risks are very low and the benefits are high. Beth from Kentucky, thank you. You're welcome. What about people with AFib? Well, AFib individuals are more prone to having a blood clot, which is why they're on blood thinners. While people have talked about blood clots with vaccines, the vaccine chance of getting a blood clot is significantly lower than getting COVID. And if you have any other comorbidities that come along with AFib, then you really need to be cautious about getting COVID. you would be considered high risk if you have other stuff going on. What about the frontline doctor is recommending you don't get it? I'm not quite sure who that's referring to. There might be a small amount of individuals that are very vocal about that, but everybody I've talked to throughout my community